Hi, I'm Dr. T, and I'm a pediatrician. On Ask Dr. T, I answer health questions from teens. Questions ranging from safe sex to self-love to questions about body parts. Let's get this episode started. This episode is all about doctors, different types of doctors, and specific issues that might arise, and letting you know which doctor can help you with your concern. Question number 1. When should a female get her first breast exam? So first, let's talk about what a breast exam is. What this person is asking about is specifically when doctors recommend feeling your own breast tissue in order to see if there are any abnormal lumps or bumps there. Now, realistically, for a young person, the chance of breast cancer is going to be super duper low. So the benefit of a doctor talking about breast exams and doing a breast exam and teaching you how to do a breast exam is going to be getting to know your own breast tissue, so that when you do get older, we're talking like 20 years from now, and breast exams get to be a little bit more high yield or are more important, then you know what your own breast tissue feels like and what you're looking for, or if something abnormal comes up. Now, quick overview, a self-breast exam is going to be with the opposite hand up and down or in a circular motion, feeling your own breast tissue and then flipping sides. We usually recommend doing this about once a month, usually after your period. In the shower is an easy way to remember. Okay, now getting to the question. At what age is the first breast exam? That's going to vary from doctor to doctor, and your general practitioner may or may not even do an exam until you get a little bit older. We're talking like in your 20s. Again, because it's so unlikely for anything abnormal to happen when you are a young person. However, it also would be common for a doctor to start doing breast exams when you have breast tissue, so toward the end of puberty. So that would be my answer, is that it depends on your doctor, but usually your general doctor, so that could be your pediatrician, your family medicine doctor, or your OB-GYN would start doing them generally after puberty. All right, question number 2. I am uncircumcised and having problems with having sex due to phimosis. Which type of doctor should I bring this to? A family doctor or a urologist? Very good question. Either one. So, a urologist is the type of doctor that deals specifically with male anatomy and the uro tract. And a urologist will be the one who does the either surgery or medication management to help you with the phimosis. However, many family doctors and pediatricians will be comfortable helping you at least with the first steps of trying to get you through that phimosis difficulty. And that will be giving you a medication that helps kind of stretch and loosen the skin. So, first stop, family doctor or pediatrician, and they will probably either help you out or give you a referral to a urologist. Question number 3. I'm a 15-year-old male who's been having some erection problems, and I don't understand why. I'm completely healthy and in very great shape. I'm worried that I could have erectile dysfunction. What should I do? So for starters, you're correct. You're very young and in great shape. The chance of you having any medical reason for you having problems with erections is going to be incredibly low. Most young people are healthy and there's no physical reason that they have problems with erections. I would specifically wonder if you are able to have erections while you're asleep and or if you have wet dreams. And that suggests to me, and it's not necessary that you do, but that suggests to me if you do have those, that the issue with erection is going to be more likely mental. And you could be getting into your own head, so to speak, about erections and getting it up when it comes to crunch time. And so that can certainly psych someone out and result in problems with erections. The other thing that could be going on is relationship issues, and that can sometimes interfere with the ability to get an erection and or have an orgasm. And so if you were to take this issue to your doctor, and you could talk to any doctor, you could talk to a family medicine doctor, you could talk to a pediatrician who's comfortable with adolescent medicine, you could talk to your pediatrician about it, but the general practitioner would be someone who you talk to about this. The other thing that your PCP could talk to you about is your mental health. So problems with depression, anxiety can interfere with the ability to have an erection as well, and that will be something that your PCP, again, so your family medicine doctor or your pediatrician, can sort of get the ball rolling with. And then if you need any extra medication, they can prescribe that, or if you need a referral for counseling, that can also be beneficial. But reasons why you could talk to your PCP. The last thing I would say, though, is that you mentioned that you are in great shape. I would wonder, or just want to make sure, that you're not taking any additional supplements like testosterone or any other performance-enhancing drugs, because that can also interfere with sexual activity and erections. Question number 4. I want to get on birth control, but I don't want to tell my mom. I'm a teen in New York City, by the way. Okay, so first of all, in the United States, and I'm sure in other countries as well, there are some rules that protect young adults, so teenagers and young adults, from having to share every last bit of information, medical information, with their parents. And so it varies in America, it varies from state to state, what topics you can talk with confidentially about with your doctor, and whether that information will be disclosed to your parents. But pretty much in most states, there's kind of an understanding that most of what's talked about with the doctor, between the teenager and the doctor, is kept confidential. Same goes for prescribing medications. Your parents don't necessarily have to know. Now, I'm going to put the name of a website you can visit to see for sure what the rules are in your state. So I'm going to put that in the description of the show. But also keep in mind that there are some services like Planned Parenthood, and then Planned Parenthood Direct is an app. And then there are some other apps as well that are available that can send birth control to your home. So that is another option for you. If you're nervous about going to the doctor and sharing all this information, look into some of those and see if that can help you. The last thing, condoms are also available and don't require a prescription, a visit to the doctor, and can be purchased by yourself. So, one other thing. Question number 5. What age should we start seeing the OB-GYN? So, OB-GYN is a way that we abbreviate obstetrician and gynecologist. And OB is the doctor that deals with babies, essentially, so pregnancy and babies. The gynecologist is more of the vaginal area, the uterus, the ovaries, and so that's the same specialty, but those are the two different parts of their field. And so, generally speaking, again, this is in America, but you don't need your first pap smear until you are 21. And pap smear is kind of the exam for the vagina. And you don't need to necessarily see an OB-GYN until you're 21 or older. Your family medicine doctor could also do a pap smear for you once you turn 21. But that would be my recommendation, is you can certainly establish with an OB-GYN earlier, but it wouldn't be necessary unless you were pregnant at a younger age, or if you had an issue in the vaginal, uterine, ovary area that you wanted to talk to a specialist about. So that's my review of different types of doctors and some of the things that we do or refer to other doctors for help with. And I can do more of this too. If there's any specialty that you want more information about, let me know in the comments. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.